Hey y'all, so I wanted to come on here and kind of talk about the different neuralgias. So as most of you know, I am bilateral trigeminal neuralgia, which is your 5th cranial nerve, and glossopharyngeal neuralgia, which is your 9th cranial nerve. And then I also have bilateral occipital neuralgia, which is not a cranial nerve, and that runs up actually through the back of your head. So most of us who've kind of been diagnosed and figure out that we have trigeminal neuralgia assume kind of a lot of these symptoms are all just one in itself, when in reality, a lot of us are finding out who've had concussions, head trauma, car accidents, that there's multiple neuralgias and are starting to be able to differentiate our symptoms. So with trigeminal neuralgia, I had so much pressure in my head like this. It felt like my head was literally gonna just explode. And I had that pressure all the time. And my symptoms weren't typical of trigeminal neuralgia. So normal are actually where you have nerve pain in your teeth, shocks in your teeth. You can't even touch your face. It's known as the suicide disease because that pain is just so intense. And I could touch my face and I didn't really have shocks or anything in my teeth. My teeth would feel kind of heavy sometimes. But I had that crazy severe pressure going on. It felt like my eyes were going to pop out of my head. I even went into the doctor and got the eye pressures tested on my eyes to see if something was going on. So, and then in my temple right here, it felt like a worm was moving in there. And when I say that, it was almost like a telephone wire where you could feel or see the signal traveling across, and you would feel that signal moving as if it was tightening up like that inside your temple. So I described it kind of like a worm moving in your temple. And then I started, my hand would kind of numb up and I would hit it and kind of open and close it to get it to get some feeling back. So that would happen. And then when I was younger, my hand and arm would go completely numb and tingle, like when your foot falls asleep, and it was just dead weight. I mean, I couldn't even feel it. And people would say, you know, are you sure you're not having a stroke or something? And that was kind of happened when I was younger, and I would get vertigo, blurred vision, and then my whole arm would go numb and it would travel into like my nose, my tongue, my teeth with nerve pain and ice pick pain to my eye right there. And then it slowly transitioned into the pressure, the eyes popping out. I also had plugged ears, ringing in my ears like tinnitus, floaters in my vision, strained vision. And then out of nowhere, I would start getting these electric shocks or stabs, electric spasms, currents, puffs of air. Everyone kind of describes them a little bit differently. But I would be talking to someone and all of a sudden, ow, and would get this stab in my eye. And it was kind of just a quick ice pick pain to my eye. And then in the end, in the morning when I would wake up and roll over, I started getting this stabbing pain in my ear over and over and over and over. And the tricky part with all this is most of these doctors, if you can touch your face or you don't have teeth pain, they automatically dismiss you. Well, you don't have that. And then separately, there's another cranial nerve called the glossopharyngeal nerve, which is your 9th nerve. And you can actually get ear pain, and it goes down into your gland and into your throat. So you can have shocks and stabs in your throat. You can have the swollen glands, the ear pain, and that's what's tricky is some of these symptoms overlap. So you can actually have ear pain that can be trigeminal, glossopharyngeal. There's another one called geniculate that they can't see on the MRI, but when they're in there doing the MVD surgery, then you can actually address where geniculate is at the 7th and 8th, the nervus intermedius, and that has to be potentially cut if it does not affect your hearing. So that's what's tricky about those overlapping symptoms. And then separately, not a cranial nerve is occipital. So that can actually be here at the base of your head. You have these 2 trigger spots where your neck is tight and the trigger spots go up and over and can actually cause pulling in your forehead, in your sinuses. And then I actually have gotten pulling from behind my eye where it almost felt like that same telephone wire with the fuse going up to my eye and pulling, and then almost like an electric spasm, like a quick little spasm like that, I would get 3 of those into the corner of my eye. So I actually had the MVD surgery on each side, microvascular decompression, and that's where they drill a tiny little hole behind your ear, and then they go in and put a spacer between the blood vessel and nerve that are touching, so they no longer have contact. And you can have a vein or a blood vessel touching, they can decompress or cauterize, or it can be a major artery that they can only decompress, because obviously that is essential. So when you're going through this diagnosis, you want to get an MRI with and without contrast, get a copy of that CD. And Dr. Lim did both of my surgeries. He is now the head chair of neurosurgery at Stanford in California. So based on state and insurance, they can do virtual consults where you can actually take a copy of your CD and work with them and upload that, and then have a consultation to see if you actually have that compression, and based off of your symptoms, the appointment, and see if you have compressions, if you would be a candidate for the MVD surgery. So some benefits of going to Stanford are they have the stereotactic MRI, which is one that will do a 3D mapping, so they can actually see where those compressions are ahead of time. And then on that hole that they make to go in, I actually have bone cement, which is more naturally for healing and acceptance, versus a titanium plate and screws that could potentially shift and cause sight pain, could potentially shift and be rejected out of your head. This has happened to 2 of my friends, and then to another friend, the plate was being rejected and actually caused a CSF leak at the surgery site. So technology, experience, all of this is so crucial, and finding someone who addresses multiple cranial nerves so that when you go in to have that surgery, all those nerves are addressed at the same time. So really understanding your symptoms really helps to find the right diagnosis of which nerves and which neuralgias you do have. And a lot of this is becoming more apparent from concussions, head trauma, and TBI injuries. So please reach out if you have had concussions, car accidents, TBI injuries. If you think you may have one of these neuralgias, the main symptom is the shocks, the stabs, the electric spasms. So if you are getting any of that in your eye, your ear, your face, your throat, that can be a symptom of any of these neuralgias. Or if you have any of those classic symptoms of the teeth pain, the shocks, the stabs, you feel like you need a root canal, a tooth pulled, that's kind of more of the classical symptoms. So please reach out. Happy to help. And there's a huge group of MVD warriors that are just trying to help, and we know how it feels to go misdiagnosed and to have doctors dismiss you. So there are people out there that we are guiding and just trying to help others, because we truly believe this is not as rare as they say. And there are many, many with head trauma that are going misdiagnosed. Thanks, y'all.